Hydrocele evacuation. Hydrocele evacuation. Dear students, I'll just show a operative procedure briefly so you can enjoy it because it's a common entity. Just see what this operative procedure. See that it is a hydrocele sac. You know that hydrocele sac is blue in color because HQD veneers there. So hydrocele sac should be evacuated with the trocar and cannula. That is the trocar and cannula. You can see the fluid evacuation. Hydrocele amber colored fluid which contains fibrinogen but no calcium. But once it comes to the mixture with the blood, it get precipitated. So this is the fluid, hydrocele fluid. So sac has to be evacuated. 4 surgeries: Lord's plication, evacuation and eversion, subtotal excision, Jabolis operation. Subtotal is called radical excision. Partial excision and eversion is Jabolis operation. So the 4 surgeries you have to remember. No role of aspiration for surgery to be dangerous, may get infected, and fluid evacuation is important. See that how fluid looks like. So that is the typical hydrocele evacuation. Then cut the sac, then invert or extend the part of the sac, and partial excision evacuation, a common procedure we do, that is called Jabolis operation. So 4 procedures: Lord's plication and Jabolis operation, evacuation and eversion in small hydroceles, and subtotal excision of the sac, especially in the large hydrocele, filarial hydrocele, infected hydroceles, where there is unclear fluid. Then you have to do the subtotal excision. So this is briefly how exactly you will evacuate trocar and cannula. Typical trocar and cannula usage. It's evacuation hydroceles in trocar and cannula. So all these are the features of the hydrocele fluid: amber color, specific gravity, fibrinogen per se does not clot, but it comes in contact with the blood. Calcium get added, gets activated in clots forms, and it can tyrosine and cholesterol crystals. You can always go through my manual of surgery hydrocele chapter and scrotal chapter and hydrocele. We can everything different specification: congenital hydrocele, infantile hydrocele, then enceted hydrocele, then hydrocele, bilocular hydrocele, hydrocele of the hernial sac. Different you should be able to draw the diagram because it's a common case kept in the exam. Hydrocele short case usually kept in the exam. How to do fluctuation in 2 directions and what is the meaning of fluctuation, everything you should know. So please go through my my manual of surgery and also clinical methods in surgery to learn about examination of hydrocele and also get about the swelling report. Also detail about the hydrocele treatment concepts, complications, and how to treat the complication and so on about the hydrocele. So get table swelling is the clinical feature in standing position. You can get table swelling in hydrocele. You cannot get swelling in the inguinal swelling. That point also very important. So you have to remember that. So students, please subscribe my YouTube channel and share channel with your friends and colleagues, and so that daily lectures you can always go through that, learn much more and more, upgrade your knowledge even for brief time, 5 to 10 minutes, but with the 2 MCQs and quotation, very useful with the entertainment, of course. So you can briefly, short period you can learn surgery daily, day-to-day basis, use your surgical knowledge. And also my live session at regular interval, maybe weekly or once in 2 weeks for 1.5 hours. The student will present a case, clinical discussion, extensive discussion with the senior professors, so that you can learn in detail. You can always interact with that also through YouTube. And also if you join live session, you get a certificate which will be very useful for your future career. Again request, please subscribe my YouTube channel and answer the MCQ. If you answer that in comment box, put it in the comment box, I'll get back to you. I will acknowledge your answer. Please, inverted ink model effect is typically observed in A, B, C, D. Please put the right answer. Reaction test is typically used clinically to differentiate encysted hydrocele from epidermal cyst, vaginal hydrocele from epidermal cyst, congenital hydrocele from epidermal cyst, infantile hydrocele from epidermal. Put the right answer in the comment box. I'll get back to you. What is reaction test? So again, request you to subscribe my YouTube channel and share with your friends and colleagues so that to learn surgery day-to-day basis. Quotation of the day is: world is going to judge you no matter whether you do or you don't do. So better to do than don't. So either do a good thing or don't do a good thing. If you don't do, they'll ask why you are not done. If you do, they'll ask why you have done it. So it's better to do and do have some credit by someone. That's exact meaning. Again, a very useful quotation in surgical field again. So students, I hope you have understood this lecture very well. Thank you so much.